Dr. Hopgood brought some props with him today, and these props are actual devices that we use in the operating room to monitor you, and different ways of making you feel comfortable. Even different types of devices to get air into your system if you need to be intubated. You want to take a few minutes and run through your devices and explain to us exactly what these props are?
Sure.
Okay.
He's going to demonstrate them on you.
That's okay.
So these I mentioned earlier that there are different categories of anesthesia. The deepest level of anesthesia we use is general anesthesia, which requires us to assist the breathing of the patient. And these two devices are what we use for that. This is what's called an endotracheal tube. I don't know if you can see it very well. There it is. So it's a plastic tube that once the patient is unconscious and unaware of anything in the operating room,
that's done by medicines that come through their IV.
Right. Medications are administered IV that make the patient unconscious and unaware. This tube is inserted into the airway or the windpipe, trachea, the windpipe, and we deliver oxygen and anesthesia gas through this tube to keep the patient asleep when we're doing general anesthesia.
So this tube gets hooked up to a machine that delivers
that hooks up here to a machine that will deliver air and oxygen mixture
that the nurse anesthetist and you control.
That we titrate and control based on the patient's weight, vital signs, and monitoring that we have.
And we're going to review some of that monitoring in a little bit. Yep.
This other device that here is called an LMA, which stands for a laryngeal mask airway, and this is inserted once again after the patient is unconscious, but instead of going into the windpipe, this device sits, this piece here sits right above the opening, above the vocal cords, opening of the airway. I like to call this a mask on a stick. It's essentially the same thing as a mask over the nose and mouth, just placed a little bit deeper down into the airway to be more secure. And this is less invasive, usually gives patients less discomfort after waking up. And essentially, I would say almost all of Dr. Perlmutter's cases that we end up having to do under general anesthesia, we utilize the LMA because it's a less invasive modality. And
so the tube doesn't go in the actual windpipe?
No, it just sits above the windpipe.
And so
you
the
have a sore
funny
throat after that.
You don't get a sore throat after this.
I mean, but with this one, you might get a sore throat. Is that what you're saying?
More commonly get a sore throat with this. Less commonly with this. You still can, but less commonly.
Much less common, yeah. I rarely have a patient who needs this, but when I do have one, I rarely, if ever, hear them say they had a sore throat from this. Because this device, this is the shape of your airway and the molding of your airway, and it sits and makes a very tight seal. There's another tube here.
This is to put air into this bladder to inflate, to make a tight seal.
And this endotracheal tube has the same thing.
A balloon cuff here.
Yeah, so that will blow up and make a very tight seal.
Correct.
And so it doesn't exactly very easily pull out. So there's different levels of ways of getting oxygen into somebody, but if possible, the preferred way is actually to have them breathing on their own, but not feeling any pain, and that's the block that we're talking about.
Yes, and these two pieces of equipment are what we use when we're doing anesthesia with block or the nerve block, where we don't have to put people under general anesthesia and they're allowed to breathe on their own naturally. This is just a mask that would fit over the nose and mouth, and the patient breathes on their own without any assistance from any machines. We do this because...
Show them on me, that'll shut me up.
There you go.
That'll make it look better. Zoom in on this.
That looks like a CPAP kind of almost device.
So it has a rubber band that looks like a face mask. And so the patient doesn't have to do anything.
Then this tube
They sound better already, don't
yeah,
they?
you do.
Yeah. And then this is just like the bag that'll drop from the top of an airplane if you have trouble.
And what goes in here?
This is a reservoir that fills with extra oxygen to supply a higher concentration of oxygen to to the patient while they're breathing.
Okay.
Because we're sedating patients, even though we're not doing general anesthesia, the breathing rate does slow down a little bit and it becomes more shallow, so we want to make sure that there is an adequate supply of oxygen there for them.
For their heart and all
safety.
that.
And then this device is another one that's a little less invasive than the mask. Is simply what we call a nasal cannula, 2 prongs that will be placed right into the nostrils and essentially does the same thing as the mask, but just is less invasive and more comfortable.